So I'm going to go ahead and get started. So welcome. If you're new here, I'm Dr. Michelle Sands, Naturopathic Physician, female hormone expert. I'm the founder of Glow Natural Wellness and the creator of the Healthy Hormone Club, where we bring accessible, affordable, and safe bioidentical hormone replacement and testing and support to women all over the world. Tonight, we're talking about hormones. So awesome. So the first question that I have is, let's see, Janice says, I was diagnosed with borderline hyperthyroid. Does HRT have any negative effects on this? There is some interaction between thyroid health and hormones, like your sex hormones. So things like hypothyroidism, hyperthyroidism, Hashimoto's, autoimmune conditions, and people on thyroid medications, they can take hormone replacement therapy, and it's actually beneficial to get your hormones in an optimal range, because hormones are like Goldilocks, and they also are interactive with other endocrine glands like the thyroid and estrogen. If you have an estrogen deficiency, you can actually have too little thyroid hormone available, or you can have a loss of your thyroid tissue. And with progesterone, if you have too little progesterone, that can actually hinder the functioning of your thyroid hormones. And there can be some indication how if your hormones are in good balance, that's going to support your thyroid in working better, producing enough thyroid hormone, having enough healthy thyroid tissue. And so it should not be an issue if you actually do need hormone replacement, if your hormones are depleted due to menopause, perimenopause, a hysterectomy, some other medications, or something else that has happened to you in the past that's affected your ovaries or your ability to produce hormones, even primary ovarian failure or premature menopause, then yes, balancing those hormones with physiological doses. I always have to say this because it's so very important. Not taking mega doses of hormones. There are lots of clinicians and anti-aging clinics and places that do like med spas, that do Botox. They're also doing hormone replacement now, and they are giving people super duper high doses. And that is above what a woman would make in regular life. That's what you don't want to do. We're replacing hormone replacement therapy is replacing the hormones that you used to have. It's not giving you mega doses of hormones that no human woman should ever have. And so that's where you run into some problems when you're doing hormone replacement at super high levels, and that can impact negatively your thyroid. It can make your hair fall out. It can make you gain weight. It can give you fibrocystic breasts. So hormones are very Goldilocks. This is why I'm a huge advocate for testing hormones, because testing hormones is really the only way you're going to know what you actually need for your body. And then replacing those hormones and seeing how your body responds to that. Because some women need a higher dose and some women need a lower dose to be in the optimal range. It's not just about symptoms. It's also about overall health, quality of life, and so many other things, longevity. It used to be that before 2002, so all through like the 60s, the 70s, the 80s, 90s, hormone replacement therapy was routinely given to women as they reached menopause, because it was well known that when estrogen declines, specifically estrogen is the one they looked at the most, but also progesterone has a lot of important things that I'll talk about in a minute. But when estrogen declines, your risk of heart disease, which kills 1 in 2 women, so it's one of the biggest causes of death of women, heart disease, dementia and Alzheimer's, and osteoporosis all increase when estrogen decreases. So it was very widely accepted that when women reached menopause, they would get hormone replacement. And this was to protect them from those big 3 diseases. Then in 2002, it had been a study that had been going on for a few years, but in 2002, the results were released of the Women's Health Initiative study. And this is a study that looked at, it originally had pretty noble causes. It was meant to see how effective hormone replacement therapy was for heart disease and stroke and things like that. The problem is that they used the hormones that were regularly given out at that time, and those were synthetic hormones. The estrogen was Premarin, so it's made from pregnant mare's urine, which is great for horses, but not so good for women. And they used that, and then they also used a synthetic progesterone, which was it was called medroxyprogesterone acetate. So not bioidentical progesterone, but medroxyprogesterone acetate. And so they had two arms of the study. One arm was where women were given only estrogen, and the other arm of the study was where women were given the medroxyprogesterone acetate and the Premarin. So the one group got the Premarin, the pregnant mare urine, and the other group got both the Premarin and the progesterone, or the medroxyprogesterone acetate synthetic. What they found was the group that took both the medroxyprogesterone acetate and the Premarin had a significant increase in heart disease and also breast cancer. And so they stopped the study right away. But what they didn't report, and what happened is that the headlines, you've all seen headlines and make it sound like it's a be all end all. And the headline was that hormone replacement therapy causes cancer. And so basically they stopped the study, all the women were taking off hormones. And now the guidelines for hormones are such that like you only give hormones if women have really bad hot flashes, and you only give them the lowest dose, and you only give them enough to make the hot flashes go away, and you only do it for the shortest amount of time possible. So they've completely forgotten about the protective effect of hormones. And what else is ignored is that one, the group of the women who got the pregnant mare urine, they didn't have an increase in heart disease or cancer. It was only the group with the medroxyprogesterone acetate in combination with the Premarin. And we now have much different hormones, just like your cell phones work better now than they did in the 90s, just like we have technology, medical advances, and so many things. We also have advances in hormone replacement therapy. We understand bioidentical hormones. Bioidentical hormones mean that they are identical to the hormones that human women make. Not identical to horses, not identical to frogs, not identical to robots, but identical to women. And so when we give back what we used to have, there is no increased risk of heart disease, of stroke, of cancer. There's actually a reduced risk when we do it correctly. And also we do see the reduced risk of Alzheimer's, reduced risk of osteoporosis, improved libido, improved hair, skin, and nails, slow down the aging process, reduce inflammation, lower cholesterol levels. The list goes on and on. There are like 35 plus different symptoms of menopause. And if you've seen my hormone restoration masterclass, I go through all of them and I go through the differences between synthetic and bioidentical in that masterclass. So if you haven't seen that yet, I will pop a link to that below the replay of this Q&A. Awesome. So hopefully that makes sense. So the problem is that we've done a whole turnaround from what we used to do for women to help support and extend their life to now we're so scared of hormones. We aren't, but doctors who are still looking at research from 20 years ago and not the latest research. And there has been research done on bioidentical hormones, and there has been research done on the effectiveness of them. And there's also a difference between orally taken hormones and topical hormones. Oral hormones have to go through your mouth, down your throat, through your gut, and then through your liver before they can go out to your tissues. And when they go through your liver, they can create some enzymes that can increase your risk for clots. They can form harmful estrogen metabolites that your body has a hard time detoxing. So I'm a huge fan of topical hormones or patches. Those are so much more safer for the majority of women. So if you have a risk of stroke, risk of clotting, you want to use topical hormone replacement and not oral. So hopefully that's helpful. Let's see, I would like to learn about bioidentical hormone safety, seeking a functional medical doctor who did some hormone blood work, low DHEA, low progesterone to estrogen ratio. So I want to know more before I meet with him next. Watch my masterclass if you haven't done so already. It's a great education. And then I have not tons, but I just started my YouTube channel. So I probably have about 25 videos on there that are great education to further your knowledge of hormone replacement. What are your recommendations for the frequency of hormones daily? Unless you are still, if you're in perimenopause where you're still cycling, you want to mimic your cycle. So a lot of times in perimenopause, we'll test hormones. And the hormone that drops first for women who are in perimenopause is going to be progesterone. So if you're in the beginning of perimenopause, you're probably going to have enough estrogen, and your progesterone is going to be the hormone that you need to replace. And then we'll replace that in the second half of your cycle. Now, if you are late perimenopause where you've been irregular for a long time, you're heading into menopause, we'll test your hormones. And we might see you also can use some estrogen. So we'll give you the estrogen for the first like 25 days of the month, and then we'll give you your progesterone usually around ovulation till about day 25, 26 of the month. But we do personalize that for everybody. And then for women in menopause, we'll generally give hormones most days of the month, and we'll take a few day break per month because that will help to renew the receptors. Because when we are cycling, or ever since we get into reproductive age, our hormones are not steady throughout the month. And in the first few days of our cycle, we basically have no hormones. So our body is actually engineered to have little to no hormones. When I say little to no hormones, I'm talking about estrogen and progesterone. So very little levels of estrogen and progesterone for those first 3 to 5 days of your cycle. So to mimic that and not overburden the receptors, then that is how we do it in our practice. And it's pretty commonly done that way. There are some women, however, that we do only take 1 day off or no days off. It really depends individually on the person and how they respond. This is why in our practice, we have unlimited support, and we retest every 3 to 4 months, more if necessary, but making sure that we're getting levels right. Like, Julie, thank you so much for doing this. I really appreciate it. I'm evaluating starting the use of BHRT. Can you elaborate of what kind of side effects you might expect when using bioidentical hormones? I've read all the benefits, what are awesome, but nobody touches on what to expect. So it depends on how you're replacing your hormones. In our practice, we like to start on the lower side and then work you up to an increased dose to get you to your optimal dose, your personal optimal dose. Some people will start you on a higher dose, thinking like that's probably where you need to be. And then sometimes in that case, and even on a lower dose, some people who are super sensitive, you might notice some water retention because your estrogen is very hydrating to your tissues. So it's hydrating your blood vessels, it's hydrating your joints, it's hydrating all of your cells. So you might notice some water retention in the beginning. When you first start estrogen, if you haven't had estrogen in your body for a while, you might notice some breast tenderness or even some more fullness to your breasts. For topical hormones, there's not really any nausea or digestive distress, but sometimes oral progesterone can cause some nausea or some vomiting or some digestive distress. Typically that will go away after a period of time. But topical hormones seem to have the least side effects. What else? If you're on too high doses of hormones, like if you go, which I am not a huge fan of hormone pellets, but if you're on hormone pellets, they give you super high doses of testosterone, like doses that you would have if you were transitioning to the opposite sex. In that case, we'll experience a weight gain, you'll experience hair loss, acne, enlarged clitoris, and some of these are not reversible. So there's not a ton of symptoms when dosed appropriate for you, but everybody is different, and some people are super sensitive. So in those cases, we'll just pull back the dose and let your body get used to it. Yeah, there's not really a lot of negativity to expect. It's really pretty all roses and unicorns, but not really. One thing that's important to note in what to expect with hormone replacement therapy, when you are taking physiological doses, so doses that your body would normally make, it can take some time for all of your symptoms to go away. And you also need to live a healthy lifestyle. So you need to exercise if you want to lose weight. Gain is part of menopause. So it is one of the symptoms of reduced hormones, but there's other components there. So your thyroid might be slowing down. You might have more inflammation, which makes you hold on to weight. You might have adrenal stress. And so the hormone replacement will help you not continue to gain weight. But if you want to lose the weight that you already have, you do need to exercise. You do need to maybe change the way that you're eating, because it's not the things that you used to do in your 20s, like you can just fast for a day and do some extra cardio. That doesn't work as you get older. You kind of have to change things up. Hormone replacement can help, but it's not going to do the whole thing. You still need to have a healthy lifestyle. Just like if you're having trouble sleeping and you have a lack of progesterone, so progesterone can definitely help you sleep, but you also might need some melatonin. You also might need to turn the bright lights off at night and stop watching documentaries about serial killers at night or the news or something like that. So hormones are part of the equation, but we also have to not forget about diet, exercise, stress reduction, relationships, nature, getting out in nature and all of that. So don't expect hormones to take you all the way, but they definitely can help, and they can help with your motivation and your kind of like desire to do things. Just like hormones help with your sex drive, they help with your life drive as well. Hopefully that's helpful. Let's see, I have hot flashes every day and I'm using estrogen gel. I think you mean estrogen gel, hopefully, but it's not working. And suggestions. I had a hysterectomy when I was 30 and I'm 57. You might need to also be on progesterone. You might have to have a balance of your estrogen and progesterone, or you might need a different dose. Other things that can also make hot flashes worse can be if you have adrenal dysfunction. So if your adrenal glands or your fight or flight system is haywire, that could be an issue. You might need to add some omega-3s. Have been found to, when you if you're deficient in omega-3, when you add in omega-3 fatty acids, that can also help out hot flashes, as can some phytoestrogens, some more vegetables in your diet. Hot flashes, why they happen is estrogen is really important for brain health, right? So I don't know if you guys know this, but estrogen is required for your brain to use its energy source. So when estrogen drops, the hypothalamus, which has our control center of our temperature regulation in our brain, some of the cells don't get the energy they need and some plaques can form. And that is when our temperature regulation starts to go off. Depending on how long, now you said that you had a hysterectomy when you were 30, depending on how long you waited to get a hormone replacement, it may take a long time to undo that. The good news is we didn't know this like 10 years ago, but now we know that your brain cells regenerate. So it might just take some time, but also make sure that you're not having any triggers. There's triggers for hot flashes like spicy food, caffeine, alcohol, things like that. So without looking at your labs, like hopefully your doctor is measuring your hormones. And if you're on topical hormones like the estrogen gel or estrogen cream, progesterone cream, things like that, if you're on topical hormones that are going in through your skin, not oral, you can't measure with a blood test, like a serum blood test. You have to measure with either saliva or capillary blood, which is a dry blood spot test. Otherwise, your hormones will not show up correctly. The Dutch test, which is a very popular test, we use it all the time in our practice, is also not viable for topical hormone replacement. It will give you pathways and it will give you other things like cortisol and melatonin, which are accurate, but for your hormone replacement, it's measuring hormone metabolites, not the hormones that are in your tissues. And so that is not the best way to measure your hormone replacement. It's a great way to measure hormones, but not hormone replacement. So make sure that you're getting tested to see if your levels are where they are. You might either need more estrogen, you might need estrogen and progesterone to balance out your estrogen. So there's a progesterone also helps with hot flashes. So it's the balance there that has to happen. What is a normal dose of hormones? It's really individual for each person. I would say like for estrogen, like 2.5 of milligrams of bias is probably a normal dose or the most common dose, but not really anymore. It's really individual. If you really want to look at your lab ranges and be in the optimal range on your labs, that's what matters, not the dose that you're taking. Just like what's a normal dose of insulin? Everyone on insulin is on a different dose because it depends on how their body's hormones are. And same thing with hormone replacement, same thing with thyroid hormone replacement. Not everybody is on the same dose. There's no normal dose. There's just the dose that you need to replace for your body. And just like with the hormone replacement ranges on a lab test, there's a range. So some women are going to feel good at the bottom of the range. Some women are going to feel good at the top of the range. And when we look at ranges, we're not just looking at ranges for women in menopause, because those ranges are super low. And menopause ranges are the ranges where you have symptoms, other ranges where you're more at risk for heart disease, Alzheimer's, osteoporosis. Those are the ranges where you're aging rapidly. So we're not looking at we're looking at hormone replacement ranges. So that is a range of what's optimal for women on hormone replacement. A lot of women will go to their doctor, and I'll get this email at least once a week, if not once a day, where they'll say, my doctor measured my hormones. I'm 52 years old. I'm having hot flashes. My hair is falling out. I'm gaining weight. My cholesterol is going up. My doctor measured my hormones and he said they're normal for menopause. And I'm just like, oh my God, I understand that it's normal for menopause, but also normal for menopause is all the symptoms that you just told me you have. So you don't want to be normal for menopause because that's like on the way downhill. You want to be optimal for a woman, not normal for menopause, optimal for a woman. So hopefully that's helpful. Is HRT possible post estrogen receptor positive breast cancer? Yes. So post-cancer, if you're no longer taking hormone suppressing medications, hormone replacement is absolutely fine. It's actually can help reduce the risk of reoccurrence, and it can also help improve your quality of life and protect you from other diseases that can take your life. So that is a huge thing that most doctors don't even know. But when you replace hormones correctly and optimally, and in our practice, when we replace estrogen, estradiol is the estrogen that is the most potent estrogen. It's the one that does all the things that we think about, the bone health, the hot flashes, like all the things that you think about what estrogen does. It's estradiol. However, we don't just give you estradiol. We give you a bi-est combination, which is estradiol plus estriol. And why do we do that? Estradiol, there's actually two different estrogen receptors. So there's the alpha receptor and the beta receptor. So for estrogen, estradiol can go on either the alpha or the beta receptor. It can actually, and the receptors are basically this little kind of keyhole on the cell. So you have your cell, and then you have a spot where the hormones can get in, and it has to match up with the hormones. So they go in a little puzzle piece. So estradiol can go into either the alpha or the beta receptor. However, estriol can only go into the beta receptor, and the beta receptors protect the alpha receptors from cancer. And estriol has been shown to actually reduce cancer risk. And also estradiol, when replaced to proper levels, is also shown to reduce cancer risk as well. But when you do the two together, you just have so much more protection and improved quality of life. So hopefully that's helpful. And we look at everybody individually. When we work with women, the first step is to fill out an intake form with your health history, your hormone history, and we review every single one of those before we ship your kit out. So if there's a reason why you should not be using hormones, we will evaluate that, and then we will also let you know. And if it's not a good fit, we will refund your money and you won't be obligated to do anything. But we can tweak the hormone combinations so that it is at the best level for you. There's no benefit to having depleted hormones, whether you've had cancer in the past or not. There's only detriment. It's going to create more inflammation, put you more at risk for heart disease, put you more at risk for diabetes, Alzheimer's, and bone degradation or osteoporosis. So there's no benefit, whether you've had cancer in the past or not, to having low hormone levels. For clarification, if you're already taking levothyroxine, which is a T4 thyroid medication, eventually will it need to be adjusted when taking hormone replacement? It may or may not. If you are taking T4, so that's T4. So when your thyroid makes hormones, it makes mostly T4, and then that T4 has to be converted into T3, which is the active thyroid hormone. If you're not making enough T4 because your hormones are depleted and we replace your hormones, then you might need less thyroid hormone. So we always recommend retesting your thyroid hormones after about 6 months of being on hormone replacement therapy in case you need an adjustment. But if that's not the reason why you're not making enough thyroid, then it won't really affect it. Depends on how depleted your hormones are, how long it's been that way. But we usually have people double check their dose, which you should be doing anyways. You should be testing. If you're on thyroid medication, you should be testing every 4 to 6 months anyways to ensure that you're on the proper dose, because your need for thyroid hormone actually changes as the seasons change, changes as your stress levels change. And for optimal dosing, you should be getting that tested on a regular basis, at least every 6 months. Let's see, I was 4 years into menopause when I had a hysterectomy. Since then, I'm gaining so much weight in my stomach, and I'm taking Synthroid for hypothyroidism. Any advice in what to look for in a good naturopath? So naturopathic physicians, if they're licensed naturopathic physicians, not just naturopaths, because there's in some states, I think all over the country actually, there is something called a traditional naturopath, which that is not a doctor. They go to a online training school where they learn about herbs and things like that, but they don't learn anything about medicine. They call themselves naturopath. And most licensed naturopathic doctors will call themselves either naturopathic physicians or a doctor of natural medicine. So just make sure that they're actually a medical doctor, because that's going to be probably important. Traditional naturopaths can be very helpful if you're looking for herbal remedies, essential oils, things like that. They are really knowledgeable in those things, but they're not medical practitioners, so they can't practice medicine or prescribe hormones or anything like that. Weight gain in the stomach, super duper common for women as they reach menopause. It's a combination of your estrogen dropping. When estrogen drops, cortisol increases, as does inflammation. And you start to gain that weight around the midsection as a result of high cortisol to low estrogen and inflammation. Also, when estrogen drops, so we talked about estradiol and estriol. There's a third estrogen. I don't know if many of you know about it. It's called estrone. So estrone is actually made by our fat cells, and it makes our fat cells turn into an endocrine organ. And so as we lose our estradiol, our body kicks in and says, hey, Michelle, you're not making very much estrogen anymore, so let me help you out. I'm going to pack on a bunch of fat cells, and those fat cells can make you some estrone. Then if we get enough of it saved up, we can convert a little bit of that to estradiol that you need so badly. So it's like a body's protective mechanism to make you store more fat. So that's one reason why estrogen replacement can help with that. It'll help stop the additional storage of fat, but the fat that you already have on you, you need to change your diet. You need to look at your macronutrient breakdown. You need to exercise and things like that to get that fat you've already accumulated off. Also looking at, you mentioned being on Synthroid, which is a synthetic T4. You may also need a combination. You might need some T3. So looking at your complete thyroid profile, your TSH, your free and total T4, your free and total T3, your reverse T3, and your thyroid antibodies, looking at all of those will give a bigger picture as to whether you might benefit from having a combination of T4 and T3. Maybe you're not making that conversion very well. Maybe you're binding it up with reverse T3, or maybe it's the low hormones that could be the problem, or maybe it's as we age, we get more insulin resistant, so we can't maybe eat as many carbs as we used to. You might need to add in some more healthy fats. Contrary to popular belief, even though it's called dietary fat, dietary fat doesn't become fat on your body. And in many cases, for many people, eating things like olive oil, omega-3 fatty acids in fatty fish, things like that will actually help you burn more fat. Avocados are great because they have fiber, they have vitamins and minerals, and they have healthy fats, and they actually help you burn more fat. So don't be afraid of fat if you feel like you're getting fat. But it's really common. They call it the menopause belly, all this kind of stuff, but it's that kind of spare tire around the midsection. It's not inevitable though. I have many patients who are super fit in their 50s, 60s, and 70s. It's just a matter of changing the way you do things. So personally, I used to run all the time. I used to do a lot of cardio. I've changed that in the past 10 years. So I'm doing weight training. I still do some cardio, but it's more like walking on an incline, less running, because running is more catabolic. It breaks down your muscles, and strength training, walking on an incline, those are more anabolic. So those build up your muscles. The more muscle you have on your body, the more calories you burn, the less likely you are fat. I've had to change that as I've aged. And sometimes we have to do that as well. So it's not just about hormones. So I have a book back there called Hormone Harmony Over 35. It's right here. This book has nothing to do with hormone replacement. This is just all the things that you can do that are diet, lifestyle, supplements, stress reduction. It has a hormone quiz in the front, and it also has a 21-day meal plan in the back for enhancing your metabolism and doing what you can to balance your hormones. Now, no amount of food that you eat is going to bring back your hormones once you hit menopause, but this will help with thyroid, this will help with adrenals, this will help with insulin and all the other hormones that can equate to more fitness and feeling better about yourself. And the other things, the estrogen, progesterone, once you're through menopause, you're really going to have to replace those. but all the other hormones are in this. So I'm going to give a copy of this book away for free. And those of you who've been on my previous Q&As know that my son Paxton usually comes in and gives away a prize, but he's at Cub Scouts tonight. So what he did was he left me a riddle. So this was he's 7 years old. And he thought it would be really cool that if you guys can in the chat answer this riddle. So try to do it in the chat if you can. I have the chat and I have the Q&A, but I'm going to tell you to put it in the chat if you can answer. Oh, we have questions in the chat too. I'll get to those in a second. Here's the riddle. And you get a free copy of the book, and you also get a free bottle of our Glow PM nighttime supplement that helps with sleep, helps with cortisol related weight gain, and also helps with hot flashes and sex drive. So it's called Glow PM. But you get a bottle of that in the book, and I'll pick 3 people from the live and 3 people from the replay. So here's the riddle. So write riddle in your comment. And it's so the more you take, the more you leave behind. What are they? So again, the more you take, the more you leave behind. What are they? So you don't have to answer it right now, but that's the riddle. And I'll put it with oh my God, someone's already got it. All right, so that was fast, you guys. I thought it was gonna take everyone forever, but people are getting it. All right, awesome. So I'll have Paxton pick somebody when he gets home from Cub Scouts. All right, perfect. All right, I'm gonna go ahead and answer some more questions. I'll let the chat keep going, and then I will go back to the chat to look for your questions there. But if you did put a question in the chat, if you can pop it over into the Q&A, that will help me keep track a little bit better. All right, so I answered that one. Okay, what are the recommendations? Oh, I did that one. All right, I lost my track on my spot. Okay, I have hot flashes every day. Oh, I already did that one. Normal dose of hormones. Yes, okay. All right, here we are. My aunt is 79 years old and has postmenopausal bleeding since February. She has had a hysteroscopy, and they say it is satisfactory, but she's still bleeding. Last time lasted for 37 days, and then a break of 10 days before she tried again. Tried progesterone, but breast, nipples, and tongue swelled. Any advice would be good. There's definitely something wrong. At 79, you should not be bleeding, and definitely not bleeding for 37 days. So I would definitely go get a second opinion from another doctor, because she might have some like tearing of the vaginal tissues too, or she might have a fibroid or something like that going on. But I would definitely get that checked out, get a second opinion. Why don't most OBGYN doctors know about this? I will tell you exactly why most OBGYN doctors don't know, because we have many of them in our program. It's because in medical school, OBGYNs do not get any training on menopause, perimenopause, or hormone replacement. They are trained on reproductive health. So girls getting their periods, abnormal periods, they're trained on pregnancy, they're trained on childbirth, they're trained on postpartum care, but they're not trained on menopause or menopause treatment. And so they don't have the training, and they will tell you that. If you ask them, they will tell you, I do not have, I got less than 1 hour of training on menopause in my OBGYN training. There's many, like, you can Google it too, and there's articles about it all over the place. There are some trainings coming out now that they can do after they graduate school as an elective. There's places like the American Academy of Anti-Aging that I've been through, A4M, that's what it's called, that does great training on hormone replacement. There's some like private hormone training schools that they can go to. They can do their own research and they can get more information. But your general everyday OBGYN that's completed their entire schooling and their entire residency has no training on hormone replacement. So they don't know. That's not their fault. They're more baby doctors than they are hormone doctors, even though you think that the lady that you're going to check out your lady parts should know about hormone replacement therapy, but it's just not in the training. And a bunch of doctors like myself are actually petitioning and campaigning to get more training on menopause health for this demographic into medical schools. It's really important. There are some schools that are starting programs that are elective, but at least they're there in the school. So going forward in the future, more and more doctors should know about it. Awesome. All right, I've been on folic acid and also got the Mirena coil, but now on estrogen, Everel 50, and my legs are so heavy, and the doctor did a blood test, and that's when they put me on it. But 4 weeks later, I still feel the same. I don't really have an answer for you because there could be so many things going on. The Mirena coil is a synthetic hormone, and then you're now on, it looks like probably that might be a bioidentical hormone. So I would, and then folic acid, I would recommend folate and not folic acid in case you might have a MTHFR mutation in your genetics. You might need folate and not folic acid, but there could be so many things going on there. So it's really hard for me to give you an answer in this forum. Let's say I'm 48 and need to start checking for menopause. When do I need to start checking? I would say if you're over 30, it's a pretty good idea to check your hormones. So at age 25 is when our hormones start declining. By age 35, that's when we start entering what we call perimenopause. So perimenopause, what it means is around menopause. So it's generally the 10 to 15 years preceding menopause when your hormones start to fluctuate, your progesterone starts to decline, then your estrogen follows, your periods get irregular, you might have trouble sleeping, you might start to be moody or have anxiety or feel depressed. Those are usually the first symptoms of perimenopause. And then you might start getting hot flashes and night sweats. You might start noticing that you're gaining weight for no reason. And that's really important. And then generally by the average age of 51, so average age of 51, that means some women are earlier, some women are later, but by the average age of 51 is when you hit menopause. And menopause is defined as 12 consecutive months without a period. So 12 consecutive months without a period, now you're menopause. That one day, the anniversary, 12 months since your last period, that's menopause. The next day, you're postmenopausal. So when we say menopause, when I say menopause in general, like on YouTube or TikTok or in this forum, I'm talking about the entire menopause transition. So perimenopause, postmenopause, that menopause transition. But at 48, I would definitely get your hormones checked. We offer a very inexpensive hormone test. It's going to test the main sex hormones. So estrogen, progesterone, testosterone. And then we also give you a test review and recommendations. And I think we have it on sale right now for $150, including the test, the review, and the recommendations. Or if you know that you have symptoms or that you need help, you can also join our Healthy Hormone Club, which we provide the testing, any hormones that you need, consultations, ongoing support, and retesting. But if you're just curious to know where you're at, you don't really know if anything's wrong, you're not sure if it's hormones or not, I would definitely recommend testing. If your doctor will order the test, that's great too. Most doctors won't, because they're like, oh, your hormones are fluctuating, it's no need to test it, or your hormones are low anyway, there's no need to test it. But that's the furthest thing from the truth. We definitely should be testing hormones. Let's see, have you found that BHRT in postmenopausal women kickstarts natural production to the extent that it precludes the need for BHRT? Absolutely not. So just like when your car runs out of gas, you need to give it more gas, otherwise it won't run. Once your ovaries run out of eggs and they stop producing estrogen and progesterone, you have to replace it in order to have the estrogen and progesterone. When you stop replacing it, your hormones go back to previously depleted levels. It's because your body's no longer making the hormones. We didn't used to live very much past menopause. It used to be that women would hit menopause and a few years later, they'd pass away of natural causes. Now we're living 1/3 to 1/2 of our life post-menopause. So that's why if we want to live to see our grandkids get married, we've got to replace our hormones. And even if you don't have any symptoms, you need to look at heart disease, you need to look at osteoporosis, you need to look at dementia, you need to look at diabetes and high levels of inflammation and all the other diseases that come along with it. And that's why you want to replace your hormones, not to super high levels, but just to optimal levels for optimal function of your body. For your brain needs estrogen, progesterone, and testosterone to function properly. Your bones need all three hormones to rebuild themselves. Your heart and your blood vessels need estrogen in order to have elasticity and in order to function properly. Our pancreas and our insulin are dependent on the amount of hormones that we have in our body. Our thyroid is dependent on it. So that's why you want to continue. But yeah, as soon as you stop replacing hormones, once you're postmenopausal, you're going to go back to the depleted levels again. Do you still have some benefit? Yes. So if you have on hormone replacement for 10 years, you have that 10 years that your body is rebuilding bone and strengthening its heart. So you still push your longevity further out than if you hadn't taken it at all. But if you want to just live your best life to your very last day, which is really how I live my life, thinking that the very last day I'm alive, I want to get up, hang out with my husband, go for a swim, do something fun, have sex, whatever, and then pass away gently in my sleep when I'm 102 years old. So that's what I'm looking for. All right, let's see. Hi, I recently purchased your hormone panel for retest. Awesome. What a great deal, by the way. I try to deliver the most affordable and accessible women's health that's available and complete. You can buy a hormone test online, probably cheaper than what we offer it for, but you're not going to get a doctor looking at it. You're not going to get recommendations. You're not going to get the support that we give you. So we try to do it so that I can still pay my nurses and my practitioners and still give you guys affordable testing. So wonderful. So it's a question. Let's see. Since I need to test closer to menses, how do you recommend I do this when I don't know the date of menses? So, okay, for testing hormones, for testing estrogen and progesterone specifically, for women who are still cycling, so if you're still getting a period most months, you want to test day 19 through 21 of your cycle. So day 1 is the first day you bleed. Even if you spot, that's day 1. And then generally day 14 in that range on average is usually ovulation. And then we like to test 5 to 7 days after ovulation. So that's day 19 through 21. And that's if you're having a regular period. Now, if you get a period once every 3 months, you haven't had a period in 2 months, you don't know when it's coming again, just go ahead and test any day. And if you're postmenopausal, go ahead and test any day. So you don't have to, your cycles, and if your cycle's been slipping around, you said between 3 and 4 weeks, that's okay. When you get your next period, that's day 1, or if you wrote down when your last period was, that's day 1. You want to get between day 19 and 21 of your cycle. That's when your progesterone is at its peak, and that's when your estrogen is at its second peak. And that's where we can really see your DHEA, your testosterone, that pretty much stays stable throughout the month. So we're not really worried about that. How do we get beautiful skin like yours? Oh my God, I used to have the worst skin, you guys. So there's many things that I've been doing over the past like 3 or 4 years to help my skin. One of them is making sure I'm getting all my nutrients. So I do take the Daily Glow and the Glow Pea on myself. Drinking more water. I drink water all the time now. I used to never drink water. So this right here, I put lemon juice in it, but I got the soda stream. So we use our filtered water from our water filter, and then the soda stream, it just carbonates the water a little bit. So it tastes like a soda. And I put organic lemon juice or a squeeze of a lemon and lime in it. And it really helps me drink my water. So I think that's probably the biggest difference in my skin. And then I also I got this, I don't know if you guys can see it. Oh my God, I don't know if it's coming up right. This right here is our red light therapy lamp. And so it's just 5 minutes a day. I let the red light on my skin, and I think that's really helpful. And then I have been going to a local esthetician. I've only done it like 3 times so far, microneedling. So microneedling is where they take this little like pen like thing, and it stamps little like all these little needles into your skin, and they do it, and you kind of skin looks a little, bleeds a little, it gets really red, but it doesn't hurt or anything. And then the redness goes away after a couple of days, and then your pores shrink, your skin like tightens up a little bit. And so that's what I've been doing. I think that the lighting in the camera makes my skin probably look better than it actually really does. But it depends on like the angle. Otherwise, sometimes my skin doesn't look as good as you guys think. Let's see, is facial hair a sign that I need to increase hormones? If yes, which hormone should be used? So facial hair and also hair loss on your head can be a sign of androgen dominance. So this is either too much testosterone or too much testosterone in relation to your estrogen and progesterone. So if you notice like I said, progesterone declines first, then estrogen follows. Usually testosterone doesn't decline yet. And then maybe 7 years later, testosterone declines. So if you're noticing facial hair, it's probably because you are testosterone dominant. So your testosterone levels have stayed the same, but now they are like exponentially like dominating your hormonal system because your estrogen and progesterone levels are low. So sometimes replacing estrogen and progesterone can really help. So usually if this is new to you, since you hit perimenopause or in the last 5 or 10 years, you've noticed this start to happen, but it's never happened before, that could be because of lack of estrogen and progesterone. That might just solve it. If this is something that's gone on since you were a teenager, it could have something to do with genetics, but also it could be that you have a genetic preference for metabolizing your testosterone down the alpha reductase pathway, which goes to something called DHT, dihydrotestosterone. And dihydrotestosterone, or DHT, is what is the more potent androgen. So this is what causes facial hair loss, acne, aggression, things like that, weight gain. And so if that's the case, if you have that preference for metabolizing your testosterone down that pathway, even if your testosterone is normal, in a normal range, things that you can do is, one, replace your estrogen and progesterone, especially progesterone. It's like anti-androgen, so that will kind of balance things out. And two, you can use some herbs to help push that pathway to the less androgenic pathway. And that is going to be, those herbs are saw palmetto, pygeum, and nettles. We actually usually recommend a combination in one supplement that is a combination of 3 herbs, but you can also get those herbs individually. So it's saw palmetto, so saw like SAW, palmetto is PALMETO, pygeum is PYGEUM, and nettles is like a nettle leaf or stinging nettle, NETLES. So those are the 3 herbs that help push that pathway. That is best in combination with the hormone replacement. Now, one thing to know, if you already have hairs that have grown, it will not make those hairs fall out. And so even if you pluck them, the hair might continue to grow, but you won't get new hairs popping up. So how do you get rid of the hairs that are already popping up in there? Things like electrolysis, laser hair removal, that's really the only way to get rid of the hairs that are already like growing. Eventually, after 3-4 years on this therapy, you can get rid of them. So hopefully that's helpful. What is your opinion on testosterone? According to a traditional midwife practitioner who says, I don't need testosterone based on my blood work, it's in normal ranges. She goes by websites that aren't necessarily current. My alternative gynecologist who can't prescribe bioidentical hormones because he's out of my state has me on a combination of estradiol and testosterone oral troche and progesterone capsule. The cream form of estradiol and testosterone gave me a rash. The midwife is concerned regarding heart issues. I would say, where are your levels testing? If you are above the healthy range for women, then you probably should not take the testosterone. If your levels are already good, there's really no need to add more hormones because that can cause weight gain, hair loss, acne, facial hair, enlarged clitoris, lowering of the voice. So those are like some negative effects of too much testosterone. But if you're low in testosterone, there's a few different pathways that you can do. You can go straight testosterone, which a lot of times is too high dose for women. You can also do DHEA. Topical DHEA converts about 50% to testosterone and 50% of it stays as DHEA. And DHEA is our anti-aging hormone. In women, we make about 25-30% of our testosterone from our ovaries, and the rest of our testosterone is made in our adrenal glands from DHEA. So when we're replacing testosterone or replacing DHEA and having it convert to testosterone, that could be a more gentler approach. But if you're not having any negative symptoms and your tests are showing that you're still in a normal range, then I don't see any issues as long as you're feeling good. Testosterone is also important just for brain health, libido, muscle tone, things like that. So you don't want to ignore testosterone. It's definitely one of our hormones. We make less of it than men, but it's still an important hormone for women. So it should not be ignored. Let's see. I've been having hot flashes and night sweats for over 6 years. I have not slept for more than 1.5 to 2 hours consecutively. Oh my God, I'm so sorry to hear this. I'm 56 years old and I still have a period, very light brown, every 4 to 6 months. I tried everything naturally for 4 years and nothing worked to help me sleep. A year and a half, I began seeing a functional medicine MD, started me on orthomolecular products, DHEA, Bioidentical pregnenolone, progesterone, which I purchased from a compounding pharmacy. She started me on estrogen, progesterone, testosterone. I felt suicidal in 3 days. Oh my goodness. This fear, dread, and hopelessness feeling also happened 3 days after starting birth control. My MD says I cannot take estrogen. Nothing is helping. You might have just not been taking the right amount or delivery method of estrogen. Usually this is the testosterone that's going to cause the aggression and the feelings of suicide. Pregnenolone can be okay, but it can also convert to different hormones at different times. So you don't really have a lot of control of what pregnenolone is going to convert to, because it's like the master hormone. So it can convert to estrogen, it can convert to DHEA, it can convert to progesterone. You don't really have any control over it. So that might have been part of the issue. I would definitely look at your hormone levels, get a test, see where you're at, and start slow with hormone replacement. If you're having hot flashes every night and night sweats, is definitely estrogen deficiency. I don't know why he would say you can't take it. That doesn't make a lot of sense, because that would be like, you can't protect yourself, your heart, your bones, and your brain, because remember, those are all reasons to take estrogen as well. You might just need a lower dose. You might just need to put it in a different location on your body, and you might need to drop the pregnenolone when you're taking the estrogen. So there's a lot of different things you can do. Be happy to help you if you need help. Hello, thank you for the live chat. What are specific blood work and our tests we should get? How to lose the weight, as this is the first time not being able to lose weight. Totally understand that. Nor did I ever had. I'm a fitness instructor who just turned 50. Oh my God, I understand. Not cool and hate hearing this is what you have to deal with now. No, it's not what you have to deal with now. I am 50 and I don't have the menopause belly. I do work out and you work out. I would look at your hormone levels for sure. So what tests? Definitely test in the very least estrogen, progesterone, testosterone. We offer a saliva test for that. You can do it at home. You can do it for any state, any country around the world. We offer it. So that's a great place to start. If your doctor will order tests, you can get a blood test. If you're not already on hormone replacement therapy, you can test in a lot of different ways. You can get blood tests. If insurance will cover it, even better. If not, you can pay out of pocket. Blood tests should be pretty inexpensive for estrogen, progesterone, testosterone. You can also test things like DHEA, cortisol, thyroid. You can add things on to test things if you want a more bigger picture, especially with the weight gain, it could be thyroid. So that's, if the weight gain is your concern, I would test cortisol at 4 times during the day to look at your cortisol pattern. Thyroid, when you're testing thyroid, look at TSH, thyroid stimulating hormone, free T3, free T4, total T4, reverse T3, and TPO antibodies. And if you want to add an additional one, you can go for TBAG antibodies. In the very least, if you need to minimize that to save money, test TSH, free T3, and free T4. Just test those if you need to minimize what you're getting, and estrogen, progesterone, testosterone. That's the bare minimum. Cortisol, you can deal with that later, or you can just take adaptogenic herbs to help balance your cortisol on your own. I always try to be mindful of telling you to take 10 different tests, because that can add up financially. But if you're 50, it definitely could be a result of the natural decline in your hormones. It's menopause belly, post-menopausal belly, the spare tire, whatever you call it. It's very common as estrogen declines. What can we do? Number one, you can replace estrogen so it doesn't keep going. And when I say replace estrogen, in our practice, we are going to always balance that out with progesterone and balance your testosterone as well. We're always going to do that. You want to optimize estrogen detox. So taking a DIM supplement, DIM, can be very helpful, and also methylated B vitamins to help with phase 1 and phase 2 of your estrogen detox. We include that in our Daily Glow supplement, what that we recommend to our patients. Get a good night's sleep, and look at your macronutrients, look at your calories in, what you're eating, and then also look at your activity level. Has that changed since over the past 20 years? Are you less active now than you used to be? Get your steps in, try to get 10,000 steps a day, and incorporate strength training into your day. It doesn't have to be fancy. You can use bands, you can use weights, you can use your body weight. Just get something that's going to challenge your muscles. And you can, if you just have body weight, you can do push-ups, you can do squats, You can hold a book and do squats. Working the muscles of the body is going to boost your metabolism. That's going to help to reduce that menopause belly. But hormonally, looking at your thyroid, making sure that's optimized, looking at your estrogen, progesterone, making sure those are balanced, looking at your nutrition, try to eat anti-inflammatory foods for at least 80% of your meals. So when you look at, let's say you eat 4 meals a day over the course of 5 days, make sure at least 18 of those 20 meals are anti-inflammatory whole real foods, good for you to contain protein, fat, and fiber. Protein is really important for muscle building, and it also takes the most calories to process when you eat, and it helps you feel full longer. So protein, fat, and fiber in every meal is going to really help. Sometimes it's not even weight gain, sometimes it's bloating that women experience. So make sure that you have good gut health as well. It's going to be really important for weight loss also. Let's see, I haven't been tested. What should I ask them to test? I think I just mentioned that. So estrogen, progesterone, testosterone, if you're looking for like menopause related hormones, and then you can throw in thyroid, you can throw in cortisol as well. Do you offer a la carte testing and a consultation? Yes, we offer a la carte testing, and then that automatically will come with a video review and recommendations, and you can add on a consultation. We do offer that. I will put a link with the replay, and you can get it on our website, but it might be hard to find because you have to go to the shop section of our website. But I will pop a link. I don't want to spend a bunch of time looking for links on my computer during this live because I think that will be like very boring for you guys to watch. So I will pop that in, or you can just email us at support@glownaturalwellness.com. That's support@glownaturalwellness.com. And we will send you the link to that test. Let's see. I wanted to get periodic testing done, but be able to continue with a prescription since my insurance. Yeah, absolutely. Yes, you can use this for testing for sure. Let's see. My recent oxytocin lab was 281. I'm 61. And was prescribed oxytocin. Is that low dose or high usage? That's not really the topic of this, but definitely go with what your doctor is prescribing. What helps with thinning hair? So we talked about estrogen and progesterone are important for many things, including hydration of your skin, hair, and nails. Progesterone helps with keeping your hair full and strong. Estrogen as well. When estrogen drops, the hair follicles dry up and they stop getting nutrition, and that causes your hair to break and fall out more. Estrogen and progesterone also keep more of your hair in the growing and resting phase, while when they decline, more of your hair follicles go into the falling out phase. So your hair follicles have 3 phases. They have the growth phase, they have a rest phase, and they have a fallout phase. So when your estrogen and progesterone are optimal, they spend more time in the growing and resting phase. And when your estrogen and progesterone decline, they spend more time in the falling out phase. Also, like we mentioned before, when estrogen and progesterone decline and testosterone is more dominant, that can also lead to hair loss as well. And then also nutrition can lead to hair loss. Stress can lead to hair loss. So stressful events or being on too strict of a diet can definitely lead to hair loss. Nutrient deficiencies, so not enough protein, not enough minerals, that can lead to hair loss. Overstyling your hair, doing a lot of pulling and really tight ponytails. Like I always have my ponytail kind of loose, but really tight ponytails, a lot of heat styling, a lot of curling, things like that. That can cause breakage and hair loss. Poor circulation can cause hair loss. And what else? Stress, low thyroid as well. Those are the big ones. Some medications also have side effects with hair loss. So anytime you have any symptom at all and you're taking a prescription medication, Google it and say the name of your medication plus side effects. And one of those could be hair loss. And so we see this every day in our practice. We'll work with women, we'll balance their hormones, and then like, my hair is falling out. And I'm like, well, have you talked to your doctor about your prescription? And like, what do you mean? And we'll show them that one of the side effects of their new prescription that their doctor just put them on is hair loss. And so all you need to do is, there's often many different pharmaceuticals that can work for the same cause. And so you just need to switch to one that does not have a side effect of hair loss if that's the case. How do you measure topical hormone creams with an exact amount? When I use creams, I just take a little out of the jar or tube. Our creams all come in a cup where it's a specific number of milliliters per pump. So we know exactly how much is coming out. So if you're using like a jar, I don't like the jars for hormones because I feel like they can get contaminated that way. We use an airless pump that has a metered dose. That's how we do it in our practice. I don't recommend like a tube. You can use like a little measuring spoon. Like the measuring spoons can come in like 1/8 of a teaspoon, 1/4 teaspoon. You can do that to measure a dose exactly. Just ask your prescribing physician what the exact dose is. I never ever recommend DIYing hormones. You can do a lot of damage to your body, and it's just not an area that you should really mess with because hormones can really help you, but they can also make things worse if you're not doing them correctly. So I never recommend like buying hormones off like a website and trying to do them yourself. And it's not just because I have a hormone program. And I've said that many years ago before we ever had a hormone replacement program. There's just some things that aren't worth it. Just like you wouldn't do your own like surgery. I don't recommend you do your own hormone replacement. And so I'm not sure if that's prescribed or not. All right. Let's see, you mentioned about water retention, tender breasts or side effects at the beginning of starting hormone replacement therapy. Would bleeding in postmenopausal women also be common? It can be if you are on a very high dose of hormones. So we don't see that hardly at all in our practice, like maybe 1 in 1,000 women will have postmenopausal bleeding. It might be even less. However, we see it a lot on women that are on, there's a protocol called the Wiley protocol where they are giving super physiological, ridiculously high doses, and every single one of those women get their period. It's not normal. It's not natural. It's a sign that your hormones are not balanced if you are postmenopausal. Now, if you're newly postmenopausal, if you just hit just got into postmenopause a few months ago or less than a year ago, it is possible to have 1 or 2 bleeds in the first 3 months of hormone replacement, and that is completely normal. There's a higher percentage, probably like a 10% of women that will see that. But if you've been postmenopausal for 10 years, you're not going to have a bleed if you are on proper doses. It's not dangerous or bad if within the first months of hormone replacement therapy you do get a bleed, but you definitely don't want to be taking doses that are going to create ongoing bleeding. Those are way too high. Let's see, I'm a New Zealand doctor, and we get taught here women without a uterus can have estrogen for life and not need progesterone. But after listening to you, is there some benefit? Absolutely. So the reason for that direction with women not needing progesterone comes out of that Women's Health Initiative study where they used medroxyprogesterone acetate. And basically, as a result of the study, we don't need to prescribe progesterone unless they absolutely need it because they have a uterus and we need to protect the uterine lining. So that's one of the benefits of progesterone. But progesterone has so many other effects. It has a calming effect on the mind and the body. Depleted amounts of progesterone can cause mood swings, increased anxiety, and depression. And progesterone is also classified as a neurosteroid, which means that it stimulates our brain processes and helps the nervous system to function properly. It eases anxiety, promotes memory, prevent the overgrowth of certain types of cells that can lead to cancers. It can help prevent fibrocystic diseases and ovarian cysts. It helps with symptoms of PMS. It helps us to better be able to handle stress. It helps us sleep, helps us to lower triglycerides. It can help prevent plaque from forming on our arterial walls. It helps our metabolism. It helps us use fat for energy, helps with insomnia, can slow down the aging process, helps with our hair, skin, and nails, reduces joint inflammation, can help eliminate or decrease headaches and migraines, and improve libido. So those are some of the many reasons why we know that progesterone is important. Mainly, it's really important for our brain, it's important for our heart health, and it's important for our overall quality of life. So to say that progesterone is not important for women who don't have a uterus is very like old school 20 or 30 year ago thinking, based on the fact that synthetic medroxyprogesterone acetate can be dangerous, and oral hormones can sometimes cause liver enzymes to elevate. But bioidentical topical progesterone can be super helpful for women, and it does not increase the risk of clots, does not increase the risk of any health concern, and is really helpful for a woman's mental health. Okay, let's see. What supplements Or what do you think about adrenal and cortisol support supplements? We're big fans. I love adaptogenic herbs. I include them in my daily glow supplement so you don't have to take like extra things. So I really like adaptogens for supporting the adrenals. Let's see, what do you think? What do you do if you're T4 free, T4 total, T3 reverse, and TAG? I think you mean like thyroid antibodies are all low. Can you still take hormones? Yeah, definitely. So if you're T4 free and total are low, that means that your thyroid's not putting out enough thyroid hormone. If your reverse T3 is low, that's good. Reverse T3 is what puts the brakes on your thyroid hormone, so you don't really have to worry about that. And thyroid antibodies, you want those to be low because that means that you have, if they're high, and then you have an autoimmune condition. So you can definitely still take hormone replacement because you don't want your thyroid hormones to be low and your sex hormones to be low. That's going to be a double whammy, and that's going to cause more problems. Yeah, your thyroid, your T4 might be low because your hormones are low or because other reasons. And so you definitely would want to probably take a thyroid hormone replacement or a thyroid glandular to a natural desiccated thyroid or some combination of T4. And if you need T3, I'm not sure if you need T3 at all, but work with your doctor who's testing you that you're working with on that. But there's no reason why you shouldn't also, if needed, take hormone replacement. Beautiful explanation of estrone being made by the fat cells and evolutionary adaptation to give the body more. Yeah, it's the body does not make mistakes, you guys. Like, so fascinating. Ever since I got into natural medicine and all through school, I've always been so fascinated by how the body tries to help us out, because don't forget, our bodies are not made for 2022, for when we have a grocery store at every corner and we can order DoorDash and we have a house with heat and air condition and lights and all of that, and there's no like wild animals outside going to eat us. Our bodies are designed for the caveman days or the like living in the wild days where there was real dangers and there was real risk of starvation, and it really had to preserve us and try to keep us alive. That's why when we're under a lot of stress, our thyroid will actually slow down. So it slows down our metabolism. So we don't burn through all our energy stores, because stress, in evolutionary speaking, is danger. And so the body is trying to keep you alive longer. And that's really what we're doing. And that's why sometimes it doesn't fit in with how we live today, but we have to think back to like how amazing the body is really just trying to help us. Can you reverse menopause fat and metabolism? Yes, you can. You can reverse any type of fat and poor metabolism. It just might include, in addition to hormone replacement, changes to your diet and exercise program. I can't tell you how many people, and I apologize if this is you, but how many people I get joining our hormone replacement program, and everyone, like I said, fills out an intake form. And on the intake form, we always ask like what your goals are and what you hope to achieve. And then we ask a bunch of questions about your health history. Then we ask about your diet. We ask about your exercise. We ask about your stress reduction. So we ask about all your lifestyle, but I can't tell you how many women will say, I need to lose weight. My weight's really bothering me. And then they don't drink any water. They don't really follow any type. They don't really know what they're eating. And their exercise, I don't exercise, or I walk for 10 minutes once a week. And I'm always thinking, wow, they really probably don't understand the importance of moving. Our bodies are meant to move. Again, evolutionary speaking, our bodies are meant to walk down to a river and get water and carry these heavy water jugs back to our camp and beat the rocks on our clothes to clean them and be physically active for most of the day. And yes, have times of rest where we sit around the fire and we tell stories, but our bodies were not designed to sit all day and to watch TV and to drive in our car and never walk anywhere. And so we really have to understand that we do have to really make a conscious effort to move. And yes, your hormones are definitely causing a problem. They're definitely making it worse, that there's a compound effect. But the fat that you've gained as a result of your hormones being depleted, and now you're putting your hormones back, that fat, we still have to lose it. The hormones are not going to melt your fat. I wish they did. Believe me, I wish they did, because I'd probably be really rich and every celebrity would be just sitting on the couch and taking hormones. That would be perfect. But we do have to put some work in. But the good thing is you're going to get more benefit out of the work that you do, because there are women, and I see this too in my intake, they're going to the gym every day and they're not getting any muscle and they're just staying the same or gaining weight slowly. We balance their hormones and they see massive results. They start to see little muscle definition. They start to look more toned. They start to feel more energized. That's great. And the other thing, when you replace your hormones, you're going to feel more energized. Estrogen is very energizing when it's at proper levels. And so it does make things easier, but it doesn't do all the work for you. So hopefully that makes sense. I'm not trying to be a Debbie Downer. I think hormone replacement is like the best thing that can happen to women in midlife ever. However, it's not the only thing we need to do. Like, I wrote a whole book about all the other things. Very important. Yeah. Okay. You guys, I see you guys all got the answer. I don't know. It took me a while when my son did that riddle. So I will definitely pick 3 people. I'm going to have Paxton, when he gets home, do that. Pick 3 people who had the right answer. And then we will send you, let's see. Oh, you guys, let's see. No, I better pick them now because I'm going to forget. All right. So this is what I'm going to do. So hopefully you guys put it in the chat. Some of you put it in the Q&A, but I'm going to pick from the chat. So I'm just scrolling my mouse and I'm just going to, whoever I land on. All right. Karen K, who wrote it at 6:35 p.m. Please send me an email to support@glownaturalwellness.com. That's support@glownaturalwellness.com. Say winner in the subject line and give me your address of where we can ship your free book and your free bottle of Glow PM. All right, so that's number 1. We'll do 3. I thought Paxton would be home by now, but I know we're going a little over an hour. I hope you guys don't mind. I'm trying to answer as many questions. All right, Mia, you also wrote the right answer. So Mia, support@glownaturalwellness.com. Send us your address, write winner in the subject line, and you answered Paxton's quiz or riddle correctly. So we're going to give you a free book. And I got one more. All right, let's see. All right, Stephanie. So Stephanie, I don't have your last name, but at 7:16 p.m. you wrote in the chat to that footsteps. So Stephanie, go ahead and do the same thing. Email support@glownaturalwellness.com and we will send you a free book and bottle of Glow PM. And if you are watching the replay, because we're going to send a replay out tomorrow, you guys can do the same thing and Paxton will pick 3 winners from the replay as well. And so you guys who are on the replay will know, because we're going to upload it to a different platform. So I was going to have you write something different, but just write the answer to the riddle. I hope I didn't say it already. All right. So you guys, I'm not going to upload the chat so you guys won't know. Awesome. All right. I'm still answering questions. So if you guys have to leave, that's completely fine. We will have a replay. But if you want to stick around, I'm still answering questions. All right. Can you still start BHRT if you're postmenopausal 6 years since your last period? Absolutely. There actually is no age limit. It more has to do with your health and your health history. But even like conventionally speaking, they always say 10 years from your last period is the cutoff. It's not really a cutoff. There is no cutoff for balancing your hormones. However, you're going to get the most benefit if you start earlier. So who gets the most benefit? Women in perimenopause, before menopause even ends. However, most doctors who do hormone replacement will say that you can't do hormone replacement until you hit menopause, which is wrong. So you're going to get the most benefit if you start before everything goes downhill, because it's always easier to prevent things than to fix them after they've already happened. So that's the best time. The second best time is as soon as you hear about it, right? So I don't care if you're 70 years old, you can still start hormone replacement. You won't get the same amount of benefit as someone who started 20 years before you, but you still will get some benefit. You can reverse vaginal dryness. You can have better brain health. You can have better heart health. You can protect your bones. You can live another 30, 40 years. And yeah, there's no wrong time to do it. The only time I would say is not right to do it is if you're 25 years old and you're already making your own hormones. You don't need to replace hormones. If your hormones are in balance, and we do get this question a lot, people wanting to help their daughters, it's more lifestyle. It's more lifestyle related. I was diagnosed with primary ovarian failure at age 20. So before I could even drink, I was having hot flashes. I was gaining weight, even though I was running like every day, 5 to 7 miles a day. I had brain fog. My joints hurt. I had gut issues. I was taking like Tums like they were candy. And I went to so many doctors and they all confirmed my ovaries were done. I was in premature menopause and I didn't believe them. And I also had thyroid issues. I also had all these other issues. So I kept going to different practitioners and finally I went to a dietitian who took me off of gluten and dairy and I started feeling better. I'm like, wow, I can feel better. And then I went back to medical school and I found out there was a lot of other things wrong with my body that were preventing my ovaries from working. And then I graduated school, met my husband, told him we would never have kids. And then before we were married, I got pregnant with my son Paxton. It was a good story. But so the only time I don't recommend hormone replacement is when you are still in reproductive age, you're under 30 years old and you don't actually have a need to replace hormones. You just maybe need to optimize how your ovaries are working. Are there any longitudinal studies comparing women who receive BHRT with those who don't? There are some studies, but there's not as many, because here's the thing, BHRT, bioidentical hormone replacement, is identical to the hormones in our body. So they don't do a lot of studies on progesterone because progesterone is progesterone, and there's not a lot of funding because there's no brand name behind it. But there are some studies and we do have links to studies on our website. And you can email our office and we can send you a bunch of studies. But there are, and the studies actually show that women who receive hormone replacement therapy live longer than those who don't, and they have lower risk of all-cause mortality. So that was actually a study that was done by the Cancer Journal that came out in May 2022, where they showed women who take hormone replacement therapy have lower risk of heart disease, cancer, Alzheimer's, all-cause mortality. What that means is they have a lower risk of dying of anything. So they actually live longer. And so that was a very prestigious journal, the Cancer Journal, which is a huge, major journal in the field of endocrine health and overall health. And that is pretty awesome. Here, do you think you would hear about that on the news? But you didn't. I was like, why is this not like the biggest headline? What are the symptoms that you for sure detect in your menopause? I'm not really sure what that means. Every woman's going to go through menopause differently. Most common symptoms are probably insomnia, hot flashes, night sweats, weight gain, fatigue. Those are probably the most common, but there are like 35 other symptoms of menopause, probably more. And even if you don't have any symptoms of menopause, so even let's say you're 55 and you never had a hot flash and you feel fine, you're still at higher risk if your estrogen is depleted, which once your ovaries are done, once you're not longer having periods, your estrogen and progesterone are going to be low. You still have that increased risk for osteoporosis, heart disease, and Alzheimer's. So even if you have no symptoms, there's still a benefit to taking bioidentical topical hormone replacement because there are really no side effects. What day of the cycle do you recommend testing for estrogen and progesterone? So if you are cycling, the first day of your cycle is the first day that you bleed. So day 1 of your period, the first day that you bleed, that's day 1. You want to test between days 19 and 21 of your cycle. If you have a ridiculously long cycle or a ridiculously short cycle, meaning if your cycle is less than 24 days or your cycle is longer than 32 days, then email us at support@GlowNaturalWellness.com and we'll give you a better way to do that, because what we want to do is 5 to 7 days after ovulation. That's what we're looking for. If you're postmenopausal or you haven't had a period in 3 or 4 months, test any day. So you do hormone testing different than a blood test. It's more thorough. You can do a blood test if you're not already on hormone replacement. They're all pretty thorough. Blood tests, urine tests, saliva, dry blood spot, you can use any of those. Once you start using topical hormone replacement, you really need to test via saliva or dry blood spot. That's going to measure the hormones in your tissues, not just hormones that are just floating around your body. And so saliva testing measures your free and available hormones. That's my favorite. Blood spot testing measures your total hormone, which is not always, some of it could be bound up. Yeah, I really like saliva and dry blood spot. They're easy to do. You don't have to go for a blood draw. They're convenient. But if you already have, your doctor will draw your blood and test your hormones. If you're not on topical hormone replacement, if you're on oral or a pellet or something like that, you can test through blood. That's completely fine. I also have prediabetes and heart disease. Gosh, I'm glad I found you. Thanks so much, Kim. I'm glad you found me too. I love teaching about this stuff. It's so fun. And it's really surprising. Like, how underserved the population of women who are 35 and up are. Even it was only like 1993 when they started including women in medical studies. Like every study that's done on any drug or procedure or anything medical that was before 1993 didn't have any women in the study. And like most studies are done like on 22-year-old men. And so the women are different. We're not small men. We're women. We're not horses. So you can't study us like you do other people. So it's only been in the past like 30 years that women have actually been included in these things. But the demographic of women 35 and up, we're so underserved. And a lot of times we'll go to doctor's offices and they'll just tell us, well, you're just getting older. There's nothing we can really do. It's because the women are complicated, because hormones are complicated. And doctors only have 5 to 7 minutes to spend with you once a year, and they just don't have time to get into that. So they'd rather tell you you're depressed, you're tired, take antidepressant, or you have a hormone problem, take these birth control pills. That's easier than trying to test your hormones, look at your symptoms, figure out where in the optimal range you should be, figure out your dosing, prescribe you hormones, retest you again. There's a lot of hands-on work that has to happen, and our conventional medical system is not really set up to optimize your health. They'd rather you need statins for your cholesterol and insulin and metformin for your diabetes than you not have to need it because, you know, pharmaceutical money makes money. Yeah, that's how it is. So my doctor suggested a DEXA scan when I first got menopause. It's supposed to be a baseline test. I found that I had osteoporosis. I was dumbfounded since I've always been a runner and run marathons. Can you comment on how BHRT might help? I am 8 years postmenopausal. So one of the primary reasons for bone loss is a loss of estrogen. So no matter what you're eating, no matter what you're doing for exercise, a loss of estrogen is going to severely contribute to your osteoporosis. Now, women who are heavier, so this is the one area where women who are overweight have improved outcomes. It's osteoporosis. So women who are thinner, lighter, tend to have osteoporosis more than women who are heavier. So being heavy, because it puts more strain on your bones, it has a protective effect. Now, weight training. So I guess running is weight-bearing exercise because you're moving your body, but being a runner is not as effective for bone building as being a weightlifter. So switching some of your running sessions to strength training sessions is going to be helpful for you. But the best thing you can possibly do to help build your bone is replace your hormones. Estrogen is the primary, but progesterone and testosterone help as well. One of the best things you can do to help build your bones. There are medications on the market, but they actually help build your bones. They just stop your bones from breaking down, but they don't help the building happen. So what happens is you get very weak bones, very brittle bones, and you're more likely to fracture. And they have limits to how long you can use those drugs because they are not good for you. But estrogen, great thing. So hormone replacement therapy can be super helpful. We see improvements in DEXA scans within 12 months on hormone replacement therapy, which is huge because it takes a long time to build bone. What do you do to balance your cortisol and insulin? I believe a lot of my problems are connected to my adrenals. Yeah, stress reduction is probably one of the best things you can do. Looking at your diet, anti-inflammatory foods, whole real foods, protein, fat, and fiber, getting some type of stress reducing practices in your day. It could be journaling, it could be meditation, it could be Tai Chi, it could be listening to a guided meditation, it could be coloring. We really have to do more things, like plan more things in our day that are restorative. It could be going for a walk in nature. There is study after study that shows going for a stroll in nature, not a power walk, not with your headphones in, not on your phone, talking to your mom or talking to your boss or nothing, just outside, no headphones, in nature, observing, looking around, being connected with nature. That is one of the best things you can do. Anything you can do for stress reduction and finding joy, like what actually gives you joy, what gives you a sense of purpose, what lights you up, what makes you happy. Doing those things like scheduling and fun is great for your adrenals and also great for so many things. But diet is going to play a huge part in insulin balance. Protein, fat, and fiber, again, my favorite combination. Every meal, focus on having protein, fat, and fiber in every meal. You should be aiming for like 40 to 45 grams of fiber per day. For protein, try to get your weight in grams. If you're in the United States, if you're in the metric system, it's going to be a little different, but if you convert to pounds, so if I weigh about 130 pounds, so I aim for 130 grams of protein per day. And then I aim for about 35 to 45 grams of fiber. And then my fats just go in a little bit with each meal. I don't count exactly, but I do try to aim for the protein because that's going to help build my bones, help my hair, help my muscles, and that helps satiate you as well. So it's best for your metabolism. How long can you be on hormone replacement? You can be on hormone replacement if you are on the right dose and delivery method for you for the rest of your life if you want to. People like Oprah, people like Suzanne Summers, they're like, I'm going to be on hormone replacement for the rest of my life. Like, why would you not? Once you feel good, like, how long do you want to feel good for? It's just like brushing your teeth. Like, how long are you going to brush your teeth for? As long as it takes. It's not mandatory. Like, you don't have to be on it forever. But most women, once they get balanced and they feel good, they will fight you if you take their hormones. There's no negative downside of it. There's no time limit to be on it, especially when things are health giving instead of dangerous. When things are natural, it's just like, how long are you going to eat healthy fats for the rest of my life? How long are you going to eat vegetables for the rest of my life? How long are you going to replace your hormones for the rest of my life? But it's not mandatory. If you just want to be on it for 10 years, and then you're like, I want to grow old and match my husband as he grows old and gradually decline, and that's what you want, I will support you in that. So it's not like it's mandatory to stay on it. Where can I find the video Dr. Sam's did on reducing cellulite? It will be on my YouTube channel. I actually haven't recorded it yet, but I'm looking at that coming out later this week. So I'm doing a whole video on what causes cellulite, how to reduce it, some of the things that don't really work, some of the things that kind of work, and some of the things that actually do work. So look for that on my YouTube channel. Is there an age that's too late to start hormone replacement therapy? Can a woman start in their 70s and benefit? Yes, I think I just answered that, but yes, you can start in your 70s. You're going to get more benefit if you start later, but you absolutely can, and you will still get some benefit. It just won't get as much benefit as you would if you started earlier, but it can make a huge difference. It can definitely extend your life. I'm interested in getting my hormones tested. You mentioned it a while ago. Yeah, you can totally get your hormones tested. If you need the link for that, just email us at support@glownaturalwellness.com. If you're watching the replay, we will put the link below the video. Let's see, my friend had her thyroid gland removed. That's horrible. I'm so sorry. Adrenal surges resulted that destroyed her life. At the beginning, bioidentical progesterone helped a great deal, but she quickly built up a tolerance and it completely stopped helping. What do you recommend? Is there another way to dampen excess adrenaline or make the progesterone work again? I would need to look at her full case study in order to answer that question. So there's probably a lot going on that I don't know about. Can young women have hormone balance? Yes, young women should definitely have hormone balance. Yes. You might be asking if they can have hormone replacement. It depends. Some women who have PCOS can benefit from progesterone replacement to help balance out the androgens. But most young women, when I say young women, I'm talking about under 30, they generally don't need hormone replacement. They just need some tweaks to their lifestyle, diet, overall wellness. Can we still test our hormones with your kit when taking hormonal birth control pills? Your hormones are going to be suppressed. We do, however, have reference ranges that are for people on birth control. So it will be a little skewed. You're not going to get the true picture of what your hormones are doing because hormonal birth control pills suppress our natural hormones and they prevent us from having a cycle. And there's like an artificial cycle that happens. So it won't be ideal, but just you can still test, but you're not going to get the best picture of your hormones. And just know with hormonal birth control, you are creating a hormone imbalance for the purpose of not being able to get pregnant. So you're basically halting your natural hormone production and putting in these synthetic hormones, which, by the way, come with the same risks as the medroxyprogesterone acetate and the equine estrogen. So it's just something to note. If you can use other methods of birth control, a copper IUD, which is an intrauterine device that uses copper to repel sperm, has no hormones. So it doesn't disrupt your hormones. So it's an alternative. or you can use like the family planning method, condoms, things like that, that if you're concerned about your hormone balance, because there are lots of side effects of birth control pills, including nutrient deficiencies. Some women never get their hormone balance back. So it's really important to note, but you can test because we do have reference ranges that we can take into account, but it's not ideal. Let's see, I'm taking your hormone replacement now. Can you explain how to apply the hormones vaginally and how often? Should it be done right before intercourse or way before? Will the creams affect my husband? Definitely email our support, and one of our nurses will thoroughly explain to you how to use hormones vaginally. But hormones creams vaginally are just on the inner and outer labia. So at the opening of the vaginal canal, you don't need to stick it way up inside the vagina. You can use, if you're using estrogen, you can use that. I would say wait 15 minutes before intercourse, and it won't affect your husband. It will absorb fully into the mucosa of the vaginal tissues. If you want to enhance your sexual experience, you can use some DHEA right before intercourse, and that will actually heighten the sensations a little bit. So that's a little bit of like a little inside off-label use of DHEA cream. Just make sure this person is talking about our Glow Natural Wellness hormone creams that are suitable for both topical and vaginal use. I would be very careful about using just any old hormone cream vaginally because it might not be approved for that use, just like for other people listening. Let's see, what are the first steps after finding out estrogen just dropped to 0 and there's still some progesterone there, still no terrible menopause, no hot flashes, no weight gain, more tired and dry skin only symptoms? So first steps would probably be to start replacing your estrogen and progesterone to a smaller degree to keep yourself balanced so you don't have to go down that route. But yeah, like I said, it's not all women will experience menopause the same. So you're lucky that you're not getting hot flashes right now. Some women don't get them until a couple of years after estrogen drops. No weight gain, that's great. But dry skin and feeling tired are symptoms. Estrogen is a very hydrating hormone. That estrogen is helps to hydrate our tissues. It helps to make collagen and elastin. So that's what keeps our skin kind of bouncy and firm. So you don't have to keep getting beauty treatments and spending a lot of money on creams and stuff like that. So that's enough for you. For me, it's the prevention of the big 3 diseases, the heart disease, the Alzheimer's, and the osteoporosis. For me, that's big. Longevity, quality of life, brain health, overall wellness. And I don't want to wait for those symptoms to happen because then it almost feels like, why did I have to go through that in the first place? So the preventative is probably the best thing that I would do. But it's your body and you make the decision for yourself. What do you think about testosterone pellet on a woman over 10 years? I am not a fan of pellets at all. Pellets are just money makers for doctors that don't do any hormone training because you get the same dose as every other woman out there, no matter if you need it or not. And I have so many women crying on consultations because they have the testosterone pellet and it has made them gain weight. It's made their hair fall out. They feel depressed, they feel anxious, they feel irritable. It's super high doses of testosterone. These women, like the range for testosterone for women, whether you're 20 or 50, the range is about 15 and 60, or for some people, it's 2 to 45, depending on what kind of test you're taking. And that is healthy ranges for women. With pellets come in at 250, 300, 500, 700, 2000. These are ranges for if you're trying to transition to the opposite sex. This is not healthy ranges for women. And the problem with the pellets are once it's inserted, you gotta wait it out. And so that's a problem. Now, what I will tell you is the first time you get a testosterone pellet, you're gonna feel, most women feel awesome. Feels great. You got so much energy, sex drive, feels great. But then the second and third time you get it, all downhill from there. And that's where the problems start. So I'm not a huge fan. Most well-educated physicians don't like pellets. It's the med spas and the estheticians and the clinics that don't really understand and educate women on hormone replacement. They're just giving out hormones and the same amount to everybody. And those are the ones that are usually doing the pellets, and not a huge fan of them. Now, again, I want everyone to experience their life the way they want to. So if you love pellets, then I'm going to still cheer you on there, but just know that it's usually doesn't end well. Awesome. See, I'm 50, and for the last month, I can't seem to stop. Oh, I'm not 50. I'm close to 50. I'm not 50. I'm like 48 years old. Let's see. I am 50 for the last month, and I cannot seem to fully stop spotting and bleeding. My period should have started and has not, and the spotting continues. The spotting can be more or less depending on the day. I'm taking bioidentical progesterone. I've increased the dose and had some effect, but did not stop. So you're 50, but you're not yet menopausal. And this is really common. You're going to have weird changes to your bleeding. Some women will have their periods will skip periods. Some women will have 2 or 3 periods in 1 month. Some women will have spotting for a whole month at a time. And that is completely normal as you're getting to the end of your reproduction years. And what happens is we have something called follicle stimulating hormone and luteinizing hormone. And those 2 hormones send a message from your brain to your ovaries, say, like, hey, can you please release some eggs so that we can get some estrogen and progesterone over here? And when the eggs don't release, your FSH and LSH keeps sending that because it's not sensing enough estrogen and progesterone. And so then that feedback loop can get a little haywire, and you can bleed more than once. You can have this uncontrollable spotting. So it is pretty normal. You can sometimes increase progesterone to decrease the bleeding because estrogen builds up the uterine lining and progesterone thins it out. So sometimes that can work, but it'll probably go away on its own. It's just that like little sputtering at the end of your period life. And so it's not going out quietly. Let's see, can you take HRT and DIM at the same time? Actually, yeah, we do recommend that. About 150 milligrams of DIM is what I usually recommend for all women taking estrogen replacement, because it just helps your body to optimize its estrogen detox. It's not going to increase or decrease your estrogen, but what it's going to do is once your body has used the estrogen and it goes to be broken down into its metabolite and then packaged up and excreted from the body, it helps with those processes. So it helps it break it down. I'm on hormone replacement. Skin is crepey on arms. What can help with that? It's going to be over time. Estrogen can help with that. Also, things like microneedling can help, laser, red light therapy, things like that. Radio frequency is another thing that can be helpful. But estrogen replacement can help. It usually takes some time, especially depending on how thin and crepey the skin has gotten. It can take years to build back up. Also, weight training can also be helpful as well to change the appearance. If your arms have crepey skin on them and you have a muscle, that muscle will smooth it out a little bit. So maybe that's helpful, maybe it's not. How late is too late post-menopause? It's never too late, honey. We will always look at health history and everything and make sure that it's a good fit for you, but there's never a cutoff. There's not a cutoff. Let's see, is the lost hair gone forever? And no, so the hair loss is hormonal. Once the hormone imbalance is fixed, your hair can start growing back. So that's a great thing. So hormonal hair loss, stress hair loss, thyroid hair loss, all of those are reversible. Genetic hair loss is the one that's not reversible, unfortunately. And sometimes hair loss from too much testosterone, that may or may not be reversible. If it's not reversible, there's still things you can do. There are some stem cell therapies that are available right now. There's platelet-rich plasma that they can microneedle into your scalp. So that's basically they draw your blood and they spin it in a centrifuge and they take the platelet-rich plasma out of it and they needle it into your scalp, and that basically will regenerate some stem cells. So that can be helpful. Minoxidil, it used to be a blood pressure medication. And they actually found out when people took the medication that they would start growing more hair. So they actually now make that in a topical over-the-counter generic. It comes in either a spray or a liquid, and that it's not natural. So I'll just say that, but it can, for most people, it can regrow hair. You just have to keep using it. And generally it takes about 3 to 6 months to see results. Anything that you're doing with hair, it takes about 3 to 6 months because the hair growth cycle is about 3 to 4 months. So basically, if whatever you're doing today, whether it's you're nutrient deficient, you're super stressed, your thyroid's not working, or your hormones are low, whatever you're doing today, you'll see in 3 months from now. So if you start replacing your hormones and get to a balanced state, in 3 months, you might notice your hair is falling out a little less. And then in 3 more months, you might notice, oh, you have some little baby hairs starting to grow. And then it keeps going. And same thing with the Minoxidil. So that topical medication, when you start using it, you're not going to see anything for 3 months. And then at 3 months, if it's going to work for you, you'll start seeing some little baby hairs grow. You'll start seeing less balding. And then you still have to keep using it every day, though, for as long as you want your hair to stay. So that's the downside. I don't always recommend it, but I know how important our hair is as women. And I know how horrifying it would be to have bald patches or to lose hair. And so I'm not holding anything back when it comes to things that work. So I'm going to tell you everything. You can get Minoxidil on Amazon, at Walmart, at Target, at CVS, pretty much anywhere. You don't need a prescription. Just be careful if you do use it, because if you get it on your face, you will grow hair in the area that it drips. So just be careful when you apply it. If you get it on your face, wipe it off right away. But you can kind of Google Minoxidil and learn more about it. All right, let's see. How do you measure a pea-sized amount for vaginal use? The next pump after will be, oh, you can just use the full pump. It's totally fine. See, when you use BHRT, how is the amount of hormone changed during the course of the month? I gather the amount of estrogen, progesterone, and the type is changed during the month. Only if you are premenopausal and you're still getting periods, then we will change, we'll cycle your hormone replacement therapy. But if you're postmenopausal, you're going to be using the same amount each day. Let's see how, then we give you instructions for all of that. How long do I need to be off hormone replacement to get tested? You don't need to be off it at all, actually. Our testing takes into account whether you're on hormone replacement. There's a specific range for that. If you're not on hormone replacement and you're cycling, there's a range for that. If you're not on hormone replacement and you're menopausal, there's a range for that. And if you're on birth control, there's a range for that. So we take all of that into account. And if you are on hormone replacement, we'd rather you take your hormones 12 to 24 hours before testing, because that's going to give us the accurate picture of your current symptoms on your current dose of hormones and what your levels are. If you're taking hormones and you have, let's say you have this set of symptoms, and then you stop taking it for the test and we test you, then there's a mismatch between your symptoms and your hormone levels. And it's hard to really tell what's right for you. So if you're regularly taking hormones, I'd recommend testing with the hormones. We give you instructions, take your last dose of hormones 12 to 24 hours before testing. That's going to give us the most accurate measure, and we'll take that into account when we're testing. We also look at all your symptoms. We do a complete symptom analysis with every test, so we can see how you feel on that dose of hormones and what adjustments need to be made. Let's see, I had breast cancer 2 years ago. Is hormone replacement a good idea? I'm not taking tamoxifen. So if you're not taking any hormone suppressing medications and it's been 2 years since your cancer and you've been cancer-free for 2 years, you do have the green light to take hormone replacement therapy. I would just recommend topical hormones in a physiologic dose, not those megadoses that we're talking about, not oral and not pellets. How do I contact your office? support@glownaturalwellness.com. That's support@glownaturalwellness.com. Okay, awesome. Let's see. I'm going to go ahead and answer like 5 more questions because we've been on for 2 hours and you guys are probably, I don't know, you guys probably talk about hormones all night. You guys are probably just like me. I'll have to do like a Saturday all day, hang out with me and talk about hormones. Let's see. I have incontinence when I jump or run. I've been on bioidentical hormones for 3 months, 25 milligrams of estradiol, 80 milligrams of progesterone. Will this get better the longer I'm on bioidentical hormones? It can, but I also recommend vaginal estrogen and possibly vaginal DHEA combination. Those are going to really help to strengthen or rejuvenate the tissues, but you may also want to do some pelvic floor therapy, just like going to the gym and lifting weights for our muscles. We have to strengthen those pelvic floor muscles, because if you ever had a baby or you've had surgeries, abdominal surgeries, or had gallbladder removed or anything like that, that does damage to our musculature down there and our ligaments and our tendons. And so you can overcome that. You might need to see a pelvic floor therapist, or we actually can refer you to some online pelvic floor therapists that are really great. There's also, if you go on YouTube and you look up Ask Dr. Joe, I think it's Jay. It's really cool. She does follow along pelvic floor workouts. I think she's awesome. I'm not affiliated with her in any way, but I just stumbled upon her on YouTube. She's a good channel to watch. Also, Isa Herrera, Dr. Isa Herrera, or she's not a doctor, she's a therapist. She's great. We have some other referrals as well. Let's see. But it's completely normal, nothing to be embarrassed about. Almost every woman who has had a baby, I would say about 50% or more of women who have babies have that issue, but it is reversible. Hormones can definitely help, but also pelvic floor strengthening. Oh, Kim, please email your address to support@glownaturalwellness.com, because when I close this webinar, I'm not sure that I'm going to be able to save the chat. I think I can, but I'm like, if you'll get your prize faster if you email support@glownaturalwellness.com. Let's see. Hi, in the replay. Is there anything about how to balance hormones when taking birth control? My niece has asked me to help research. So that's like lighting a fire and trying to put it out at the same time. Birth control pills, hormonal birth control pills, contain synthetic hormones. The sole purpose of birth control pills is to stop your cycle and stop the release of estrogen and progesterone. So you're putting in these synthetic hormone mimickers, endocrine disruptors, to prevent the natural release of estrogen and progesterone and the release of the eggs, so you do not get pregnant. So you're purposefully, in taking birth control pills, throwing off your hormone balance. So you cannot balance hormones ideally and use birth control pills. Can you take hormone replacement, at least some progesterone, while you're on hormonal birth control to help with your symptoms? You can, but you're never going to balance your hormones on hormonal birth control. Insurance cover hormone replacement if as a result of hysterectomy. Some will. We have some practice members who are with some of the alternative insurance companies, such as Samaritan Ministries, which is a health sharing, and they cover hormone replacement. Some insurances only cover like the synthetic hormones, and they might only cover estrogen if you've had a hysterectomy, because they're not going to see the medicinal value in progesterone or testosterone for that matter, or DHEA. A quick guess, my niece would be metabolic syndrome, very mentally bright, lots of overweight, hearing about lifestyle now. Yeah, my book, I'll put a link to the digital version of my book. Everything in here, even though it says over 35, will apply to young women who are trying to balance their hormones. So I highly recommend this over pharmaceuticals or hormones, giving them to young children. This is really helpful. Contacting my office, support@glownaturalwellness.com. So support, SUPORT, @glownaturalwellness.com. You can email us and just say, hey, I was on the training and I need more help about signing up for the hormone replacement program, or ordering a test, or if you have other questions. I will be doing another one of these. So if you didn't get your questions answered, I'll probably do another one next week, because I didn't realize how many people. There's still like well over 100 people on, and we've been doing this for 2 hours. So that's awesome. I love that you guys want to learn about your hormones. I think this is so awesome. Let's see, is blood test or saliva better for testing? I have not had hot flushes in 1 month. I still get periods, but every 2 months. They're just as equally good if you're not already on hormone replacement therapy. Blood test, fine. Saliva test, fine. Dry blood spot, urine, dry urine testing, they all work. Once you get on hormone replacement therapy, then it changes. So if you're on topical hormone replacement therapy, blood serum is not really going to show the hormones because they're in your tissues. Saliva is going to be better, or dry blood spot in those cases, but you can do any of those tests. Is BHRT organic? Can you get organic BHRT? So technically, by definition, our base of our BHRT creams is organic. However, the hormones themselves, how they're made, bioidentical hormones, how they're made, there is a chemical structure inside of the wild yam, and it has to be taken out of the yam, brought into a lab. Some of the little chemical parts have to be removed, and then it becomes identical to estrogen progesterone, testosterone. And so because of that, because there has to be a lab involved, technically not organic, but it's identical to the organic material in our body. Yeah, it's natural and it comes from organic ingredients, but just technically, it's not technically organic because you can't eat a wild yam and get hormones because the diagenin is the chemical structure. It's the component in the wild yam. It has to have some parts removed in order for it to be identical to the hormones. So it has the same chemical backbone. If you ever went to chemistry class, there's like carbons and hydrogens and oxygens that are like the little tails and stuff on the chemical structures. You got to remove some of those in order to make it identical to each of the hormones. So hopefully that's helpful. Will this help even though I've had a hysterectomy, but one ovary is left? I'm now 59. I feel like I really went through major menopause the last 2 years. Yeah, so when you have a hysterectomy, if you leave at least one of the ovaries, you can still produce estrogen and progesterone, but you're still going to go through menopause eventually, and that ovary is going to stop working. And that's going to give you those symptoms, the fatigue, the osteoporosis, the brain fog, all of those things. And so yes, hormone replacement therapy absolutely will help you. It's one of the best things you can do. See, is there another version of estradiol vaginal cream? I don't understand, they don't contain harmful ingredients such as sodium lauryl sulfate. Yeah, our estrogen cream contains none of those ingredients. You can eat it. It's so clean. It's based in organic coconut oil and organic olive oil. Super, super clean. That's the problem a lot of times with compounded pharmacies. Every time you go get your prescription, you might have a different base because it's not really standardized. Let's see, part 2, hysterectomy was at 35. Yeah, so like I said, when you have a hysterectomy, you can either have a hysterectomy, just your uterus. You can have a hysterectomy plus an oophorectomy, which is one or both ovaries. So if you get the hysterectomy and both ovaries out, you're pretty much going to go into menopause shortly after that. But if you keep at least one ovary or both, and you just have the uterus removed, you still can be producing hormones, but you're still going to go into menopause at some point. And at that point, you're going to get most people will get the symptoms of menopause. I know we had the one lady who, I don't have any symptoms, and that's awesome, but it's still early. Most women will get the symptoms. At least some. Everyone's going to have different symptoms. A relative told me that her doctor said the blood test shows that she should never take reproductive hormone. She's recovering from breast cancer, tumor removed. Do you know what blood this is? It's probably just because she's had cancer, and most doctors will look back on that 2002 study where there was a slight increase in breast cancer in the people who took the synthetic progesterone. They're like, you can't take any hormones if you've had cancer. Never, ever, nobody. So that's probably what they're doing. Because that's, I would say, like, you go out to most doctors who have no training in hormone replacement therapy, but they've heard of that study. And they'll say, oh, hormones, breast cancer, you can't do it. So that's what it is. I think that's what it is. Let's see, I'm interested in Bhrt for perimenopause, but I'm concerned that it will extend the peri period. Is that true? No, it doesn't change when you're going to go into menopause. You're still going to go into menopause at the time that was predetermined from when you were born. It's predetermined. Nothing's going to extend it or take it away. You have a certain number of eggs. Oh, no, what will extend it is how many pregnancies you've had. So if you get pregnant, then you have 9 months without a period or longer, 9 to be breastfeed. It's going to be longer. And so you don't release eggs during that. Therefore, you'll have more months until you hit menopause. You have a finite amount of eggs. And once the eggs are gone, you're going to go into menopause. So taking hormone replacement will just help prevent all the symptoms and help extend your life post-menopause, but it's not going to extend your perimenopause. Let's see. I've been told I have atrophy of the uterus. What can I do? Atrophy of the uterus or of the vaginal canal? The uterus, if you're not going to have babies anymore, you don't really have to worry about that. If your uterus is atrophying, that's completely fine. If you're still looking to have children, then I would seek help from a fertility specialist. But if someone is on a vaginal hormone for a good period of time, would you recommend transvaginal US to check the health of the vaginal area? Oh, ultrasound. I would say it's not necessary unless you're having any issues. Okay, can I take DIM when taking birth control pills? Yeah, you definitely can. And I think it's probably a good idea because the synthetic estrogens, if your birth control pills have estrogen in them, it's harder for your body to detox. What is DIM? DIM is a compound found in cruciferous vegetables to help with phase 1 estrogen metabolism. Or metabolism, when I mean metabolism, the detoxification. the breaking down so that it can get out of your body once it's used up. Can I really build my bone at age 65? Absolutely. With osteoporosis, absolutely. We see it all the time. You can build bones at 70, 75, 80. There's no age limit for building bone. How long does it take to rebuild it? It depends on how aggressive you are with your treatment. The only thing I can do is take estrogen, do bodybuilding workouts, add weight-bearing exercises, take calcium supplements. What other important minerals such as silica, boron, and others? Yeah, I would say all your minerals like magnesium, all your minerals are probably good to have. Having a well-balanced diet is going to be helpful, but definitely optimizing protein, weight training. And there's some places called Osteostrong that are gyms throughout the country that have like specific machines that are meant to like really help you if you're afraid to work out at a gym. You can use resistance bands. There's lots of different equipment. There's something called a power plate. That's a vibration technology that is also super helpful for bone building. So you don't have to be a weightlifter per se, but I think you're doing all the things. You may, in addition to estrogen, if you're not already doing so, also take progesterone and optimize your testosterone levels either with DHEA topical or adding in testosterone if necessary, just to keep all of your hormone levels balanced because they all do contribute in some way to bone health. Okay, so I'm 58 years old. I had the removal of ovaries and uterus due to endometrial cancer. Is bioidentical hormones a benefit for me? It depends how long ago that was done, but yes, if you're 2 years post-cancer and you haven't had a reoccurrence and you're not on hormone suppressing medications, then you can definitely be a candidate. Will improve your quality of life and extend your longevity, and will also protect you from heart disease, which what most people don't realize, like when they're not doing hormone replacement, 1 in 2 women, 50% of women over age 50 will die of heart disease, where only 1 in 35 or less will die of any form of cancer. So heart disease is a much bigger danger, and we know we can protect ourselves from heart disease with hormone replacement therapy. Why would you not? 50% chance, that's a pretty high chance. It's just something to think about. Let's see, I'm on topical HRT for 5 months now. How long before I stop having hot flashes? You should probably have stopped having hot flashes already, unless you have some hot flash triggers or some adrenal issues or maybe deficiencies in like omega-3s or something like that. So if there's some other issue going on, I have about 15 per day with oral BHRT, that might be the issue. I never had, oral BHT, you didn't have any hot flashes. You might need to change your dose a little bit, or you try progesterone 1 capsule a day. Depends, maybe if you're older now, maybe the hot flashes are a result of age if you were younger when you did the other hormones. I'm not really sure without looking at like more of a big picture, but there could be other reasons behind the hot flashes as well. You might want to make sure you're rubbing in your creams correctly too. So you want to apply your creams to thin areas of skin. So like your forearms, your inner thighs, your lower abdomen, or behind your knee, and make sure you're rubbing them in for a full minute. That helps the creams to absorb properly. And then also make sure you're not putting on any lotions like suntan lotion or body oil in the same areas that you're putting your topical hormones, because that can prevent them from absorbing. I would definitely retest your hormones and see where they're at. Make sure your levels are good. You might need an adjustment to your dose because maybe your dose of the oral hormones was higher than your dose of the topical hormones, or vice versa. So make sure that you're getting your hormones tested. Let's see, hormone replacement therapy also resolve urinary incontinence. It can help with the combination of hormone replacement therapy plus maybe some pelvic floor therapy as well. So that can definitely help. When we lose estrogen, we get vaginal dryness, and then also our vagina actually shrinks. Our vaginal tissues atrophy, our muscles down there atrophy, the skin gets thinner, the nerve endings retreat and kind of go a little bit dormant. So we have less sensitivity, we have less strength. And so we're not able to hold our urine. We're not able to, that's why we have more incontinence. That's where hormone replacement can come in. And then also, depending on how long you've been hormone deficient or how atrophied the tissues are, you might need some pelvic floor therapy to gently rebuild and re-strengthen those pelvic floor muscles. So hopefully that's helpful. Does having an ovarian cyst affect hormone production? It could be a sign of estrogen dominance. So possibly that your estrogen levels are higher than your progesterone levels relatively. So that can be a sign of estrogen dominance. What, if any, are health risks of the copper IUD? Copper IUD, so is it effective for birth control? Yes, it is. There's no hormones involved, but the copper itself repels the sperm. And so the sperm don't like the copper. And so that's how it works for birth control. Risks with any IUD are bleeding, pain on insertion, things like that. But there's no like health risks of the copper IUD. Is pretty safe. Awesome. All right, you guys, I'm going to, it's 10 after 8, so I've got to actually go put Paxton to bed. So I'm going to go ahead and end it here. Thank you guys so much. I will go ahead and schedule another one of these within the next week so that we can get the rest of the questions answered. And I'll put a button when we do the next one so you can write your questions in. And I'm going to download the chat as well. So the chat and the Q&A, I'll try to download that when I close this webinar so that I can, if I can't answer them, I will make videos for you guys on YouTube answering questions that are alike. I'll group them together so that you guys can all get your answers. So thank you so much. If you put your question in the chat, I didn't even get to those. I've been just answering the questions in the Q&A. Thank you so much. Sorry if I didn't get to your question. I tried to take as much time as possible, but we will do another one of these real soon. So thank you so much. I will talk to you soon, and be sure to hop over to my other videos on YouTube because I have several Q&As on here. Also, I have lots of videos about other topics around hormones and health. So thank you guys so much. Thank you for all your appreciation in the chat. I really appreciate it. I do love doing this. I will be doing more of these, and you guys are awesome. Thank you so much. Have a wonderful night, and I will see you soon. Take care. Bye-bye.